last time with the acute inflammation, so I'll be continuing with the chronic inflammation today. So chronic inflammation. Yeah, as we studied in the last time that what are the outcomes of acute inflammation. So in that there was one with the chronic inflammation, like acute inflammation will progress to chronic inflammation. If there is like acute inflammation is not able to control the infection or any stimuli, then it will progress to chronic inflammation. So now we'll be starting with chronic inflammation. So what are the causes of chronic inflammation? So in this topic we'll be studying about the causes, morphological pattern of chronic inflammation, mediators of chronic inflammation, and what are the granulomatous inflammations. So what are causes? If there's persistent infection which is not able to be controlled by acute inflammation, it will lead to chronic inflammation, like microorganisms which are difficult to eradicate, such as mycobacteria and certain viruses, like certain viruses, bacteria, fungi, parasites. These organisms actually evoke the immune response, which is a delayed type of hypersensitivity. These inflammatory forms sometimes take a specific pattern known as granulomatous reaction. So what is granuloma? We'll be studying it a bit later that there is a condition in which there is accumulation of macrophages, there are fibroblasts and these like some plasma cells and all, they will contribute towards this formation of granuloma, which is the hallmark of chronic inflammation. So autoimmunity. What is autoimmunity? Like your body immune system is not able to recognize between the foreign as well as your own body, like your own body's function, like your own body, like means yourself. Your immune system is not able to differentiate between the self as well as the foreign body. So it will create it will cross-link between this foreign body and this self tissues, and it will lead to autoimmunity, like destruction, like attacking its own body organs. So that is autoimmunity, like attacking towards the own self. And now some allergy, like immune responses against some environmental substance are the cause of allergic disease such as bronchial asthma. Like we have already seen that there are many patients who are actually like having this bronchial asthma, and it also comes under chronic inflammation because they have to take the medication for their lifetime for survival. So it's chronic. And prolonged exposure like such as silicosis and atherosclerosis, these are like even asbestosis, these are actually leads to this chronic inflammation. So what are morphological patterns? Like there are infiltration with the mononuclear cells, which includes macrophages, lymphocytes and plasma cells. So these are the cells which are responsible for chronic inflammation. And then I told you about this acute inflammation, that mostly it is neutrophils which actually come and attacks, which goes towards this noxious site of inflammation. And in this chronic inflammation, it is macrophages, lymphocytes and plasma cells. And also I told you that chronic inflammation is more dangerous because of tissue destruction in that class, because it leads to tissue destruction, like macrophages and all, they release some mediators which causes tissue destruction. So this is the second feature of this thing, chronic inflammation, which is induced by a persistent offending agent or by the inflammatory cells, like I told you, macrophages. And now attempts at healing by connective tissue replacement, like this tissue has been replaced by fibroblast, and these things leads to fibrosis, like there will be contraction and there will be shrinkage of the tissue, so it will lead to this healing. So there is angiogenesis also, like there will be small vessels proliferation. Actually these are the things which we can see in this chronic inflammation. So what are mediators of chronic inflammation? I told you it's macrophages, lymphocyte, eosinophils, mast cell, and sometimes neutrophils can also be there, actually acute or chronic inflammation, which we say. If you are seeing both neutrophils as well as lymphocytes in the inflammatory site, and there are like predominance of lymphocytes, then actually we call it as acute or chronic inflammation. Like there has been a chronic condition which is like progressive, and suddenly there is another episode of inflammation, the new inflammation, which is actually an acute inflammation. Cells derived from monocytes, part of mononuclear phagocytic system. So what are macrophages? These are the mononuclear cells because they usually have a single nucleus. Actually, how these monocytes are formed, like macrophages are formed. in your blood, it actually moves in the name of like monocytes. As you know, there are neutrophils, lymphocytes, monocytes, eosinophils, and basophils. These monocytes actually move to the tissue, and it is called as macrophages. There are like basophils which actually move to a tissue, and it is called as mast cells. So these are the names. Like their function is different in both the like blood as well as in the tissues. So what are examples? Like normally diffusely scattered in most connective tissue and liver. In the liver, what are these macrophages? These are the fancy names which are given to this macrophages. Like in liver, it is called as Kupffer cell. Spleen and lymph node, it is called as sinus histiocytes. CNS, it is called as microglial cells, and lungs, it is called as alveolar macrophages. So these are the names which are given to this special type of macrophages in their respective organs. So see, this is the bone marrow and the yolk sac, the liver. Like in the fetus, it used to be like progenitor yolk in the yolk sac and fetal liver. These are the sites of production of this monocytes and all. And this bone marrow is the site for adults, like after giving birth, means after the child is born. After 4 to 5 months or 6 months, the bone marrow used to take over the lymphoid proliferation. So there is lymphoid stem cells which actually goes to the blood and it forms monocytes. And in the progenitor cells, it also forms these monocytes. This macrophages, like in the blood, it will be monocyte, and when it goes to tissues, it will be called as macrophages. So activated macrophages in inflammation, macrophages, skin and intestinal tract, residue tissue in macrophages. Okay, this lymph after the inflammation, like skin and intestinal tract, this will be present in the inflammatory sites, and the residue sites, like in the inactivated forms or in the specific organs, these are kept as Kupffer cells, alveolar macrophages, and microglia. So in the peripheral blood smear, this monocytes, it looks like this. It has an indentation in the nucleus. It looks like this. So, and this is the activated macrophage, like which is more of vacuoles are there, and then there's a lot of secretory granules which are present. So this is the one which looks in the electron microscopy. So now we can see that different cells, like this is the Kupffer cells, macrophages in the brain, and then this is the glial cells in the, this is the Kupffer cells in the livers, and this is the glial cells in the brain. And then alveolar macrophages, and this is sinus histiocytes, these are present. Like in this you can say macrophages are these ones. And in this you can see these are the glial cells which are actually macrophages. In this also you can see these two other ones. And in this you can see this one. This is the one macrophages. So the dominant cell in most chronic inflammatory reactions are macrophages, which contribute to the reaction by secreting cytokines and growth factors that act on various cells. So the dominant cell will be macrophages, and it will be secreting some cytokines and growth factors through the various cells, and it destroys the foreign invaders and tissues. So it will be destroying both the foreign invader cells, foreign invaders organisms and all, and it will also destroy the tissues. And by activating other cells, notably by T lymphocytes. So it will also by the cytokines, it will activate T lymphocytes, which will help in destruction of these foreign bodies. So there are two major pathways. It is a classical pathway and the alternate pathway. These two pathways are the ones which are actually responsible to activation of the macrophages, like monocytes. So if it is like interferon gamma, it will lead to classically activated macrophage. And if it is interleukin 13 and 4, if these two act on this monocyte, it will lead to formation of alternatively activated macrophage. This classically activated, its main function is inflammation, but it's alternatively activated, it leads to anti-inflammatory effect, and also leads to fibrosis and repair in the tissue. So these are two macrophages, two steps which actually helps in this thing, like activation of macrophages. So remember, alternatively activated is anti-inflammatory effect, and classically activated, it helps in inflammation as well as microbicidal. Like it will help in killing the organisms and destroying these things. And alternatively activated, it will lead to fibrosis, like there will be tissue like shrinkage and all because of fibroblast proliferation in the tissues. So the second is the lymphocytes. So microbes and other environmental antigens activate T lymphocytes, which amplify and propagate chronic inflammation. Like T lymphocytes, there are two types of lymphocytes, like T lymphocytes and the B lymphocytes. T lymphocytes are the one which are actually responsible for like immediate action on the bacteria and fungi, whatever the noxious stimuli is there. And the B lymphocytes are the one which actually are produced by the antibodies. Like they produce antibodies like IgA, IgM, IgG. These are the antibodies which are produced by B lymphocytes. So in this acute chronic inflammation, T lymphocytes are the one which is like immediate. It will be acting immediately. There are three subsets of CD4 T cells that secrete different types of cytokines and elicit different types of inflammation, like T helper 1, T helper 2, and T helper 17. So T helper 1 is the one which produces cytokines interferon gamma. So it activates macrophages by classical pathway. So T helper 1, it produces interferon gamma and it activates classical pathway. Like it will lead to inflammation. And T helper 2, it secretes interleukin 4, interleukin 5, and interleukin 13, which actually is responsible for alternate pathway. So, and T helper 17 secrete interleukin 17 and other cytokines. Like there are some more cytokines which are secreted by T helper 17, which induces the secretion of chemokines responsible for recruiting neutrophils into the reaction. So, T helper 17 is the one which is responsible for recruiting neutrophils in chronic inflammation. So, these are the ones which are actually shown in this thing. Like T lymphocytes, this 1 and 17 is acting, and leukocyte recruitment, inflammation, and other mediators. It will lead to interferon gamma, it will lead to macrophage formation, then classical macrophage activation, then interferon gamma, interleukin 1. It leads to recruitment of this neutrophil and monocytes. So these are the ones. So what are the eosinophils, mast cell, neutrophils? These are the other cells which are responsible for chronic inflammation. So eosinophils are abundant in immune reactions mediated by IgE and in parasitic infections. So actually, when is IgE higher? Actually, if there is any allergy or if there is any parasitic infection. So this is the one which is responsible. Like this is the one which will be recruited for the, fighting off these things like parasitic infections and allergies. So in your body, these IgE levels will be raised. Allergy conditions and mast cell. These release mediators such as histamine and prostaglandins. So this histamine and prostaglandins, these are the ones responsible for the chronic pain. So when you are having like chronic pain, means like you are not able to sleep, like for months and months this chronic pain is there. So these are the ones like prostaglandins and histamines which are responsible for that chronic pain. And neutrophils play a part in acute and chronic. I told you like in acute inflammation, neutrophils is it is the main cells which is responsible for this acute inflammation, and in chronic lymphocytes, but neutrophils also play a minor role in this chronic inflammation. So in osteomyelitis, neutrophilic exudate can persist for many months, and neutrophils are also important in the chronic damage induced by lungs by smoking. In lungs by smoking. So in chronic damage, like the smokers and all, there is some like emphysema and these things are there, which is actually self-destruction of the lung tissue, which is responsible for this neutrophils. These are the ones which are actually responsible for this emphysema, COPD happening in this chronic smokers and all. So what are granulomatous inflammation? As you can see, I told you about the granuloma. So this is the granuloma that is formed. These things, this one is the granuloma. This one is the granuloma, this one is the granuloma. So what is granulomatous inflammation? Granulomatous inflammation is a form of chronic inflammation characterized by... So granulomatous inflammation is a form of chronic inflammation characterized by collection of activated macrophages, often T lymphocytes, and some associated central necrosis. So in granuloma, you can see central necrosis. Like this pink color fibrin materials which is deposited is actually necrosis which is present. And then it is surrounded by inflammatory cells like macrophages and T lymphocytes, like activated macrophages. And activated macrophages, it will be formed of like slipper cells like this. These are the activated macrophages. These are slipper-shaped cells, which are actually this. And actually, this is the chronic this granuloma formation. In this, you can see this activated macrophages. These activated macrophages may develop abundant cytoplasm and begin to resemble epithelial cells, which are called epithelioid cells. So these are called epithelioid cells, like macrophages. These are called epithelioid cells. So, and some activated macrophages may fuse and form multinucleated giant cells, also called Langerhans cells. So, in this condition, you can see Langerhans cells. These are the Langerhans cells, which is a form of granuloma. The granuloma which is formed in this is called Langerhans cells or multinucleated giant cells. These are actually the giant cells. So, these multinucleated giant cell formation, which are also called as Langerhans cells. So, this type of immune granuloma are produced when infecting agent is difficult to eradicate, like in the TB. Like TB, it's a classical example of granuloma formation. In that granuloma will be formed, and it's because like chronic condition, like TB is a chronic condition, like patient is having for months and months, and when it is not able to cure, like if your body immune system is not able to cure it, then it leads to formation of this chronic condition, and it leads to this granuloma formation in the sections, like in the tissues. What is foreign body? Like foreign body granuloma incited by relatively inert foreign bodies. Like when there is foreign body, like like any suture material is left in your body after operation, which is not like it is not lysed. Like there are some digestible suture materials which is actually it's dissolved in the body by the body like in immune responses, but there are some like sutures and all like silk which is not actually digestible. So these kind of this suture materials, it will lead to formation of foreign bodies. So, and this foreign body granuloma form around materials such as talc associated with IV drug abuse, sutures and other fibers that are large enough to preclude phagocytosis by a macrophage. So these kind of granuloma, foreign body granuloma, these are formed because of this IV drugs like talc and this sutures and fibers which are not able, like macrophage is not able to ingest it. It's not able to take inside and digest it. Then it leads to formation of foreign body granuloma. So there are some examples of disease with granulomatous inflammation. Like I told you, TB is the classical one, which happens like this caseating granuloma, like caseating type of necrosis is there in this TB, and there will be surrounded by this granuloma, this inflammatory cells. And then in the leprosy, this is another example. In this there is non-caseating granuloma, then syphilis, which is caused by Treponema pallidum, which is also called as gamma. So, like there will be central necrosis without loss of cellular outlines. Like you can differentiate between the cells, like what kind of cells are there in this granuloma, in this necrosis, but there is like architecture of the organ will be maintained. Like you can say like this is the liver, so it is the liver. If this is the spleen, so it is the spleen. Like the architecture will be maintained and it will not be lost. And then there's cat scratch disease, but in this giant cells are uncommon. It's not very common in this. Then sarcoidosis, and then chronic inflammatory Crohn's disease like inflammatory IBD. This is occasional non-caseating granuloma. What are systemic effects of inflammation? So, what happens to your body in the inflammation? There will be fever. So because of interleukin 1 and TNF. Like these are the cytokines which stimulate production of prostaglandins in hypothalamus. So it actually increases the threshold level, your temperature. Hypothalamus is also known as temperature regulating body, like temperature regulating organ. So it increases this cytokines. It increases the threshold of this organ. So your body temperature, which was maintained at 37 degrees, like normal temperature, it increases to 38 or 39 degrees. So your body will try to maintain the temperature of 38 to 39 because the threshold has been increased. So this leads to fever. So which is responsible for that? Cytokines, interferon 1, TNF, tumor necrosis factor, and interleukin 1. And there's production of acute phase proteins from the liver, which is C-reactive proteins, which is stimulated by interleukin 6, acting on liver cells. So acute phase proteins are produced by the liver cells by interleukin 6. Then there is leukocytosis, like there is more of leukocytes production because of colony stimulating factor, like this CSF, this colony stimulating factor. These are the ones which actually act on the blast cells and the progenitor cells of the leukocyte formation. So the blast cells are the ones which are giving rise to, with various steps of these things, cell division, they will give rise to leukocyte. So this CSF cognitive stability factor, this will go and stimulate the blast cells. So the blast cells, this will lead to formation of leukocytosis. And in some severe infection like septic shock, fall of blood pressure, disseminated intravascular coagulation and metabolic abnormality induced by high level of TNF and other cytokines. So there can be some septic shock, and because of the dilation of blood vessels and all, there will be fall of the blood pressure because of like hypotension. So, and there will be like a disseminated intravascular coagulation also because of this some kind of acute phase proteins which does that. These are the ones like systemic effects of inflammation. So actually those were the chronic inflammatory conditions. Now we'll see that like how the body tries to repair the tissue, like how it tries to, after the chronic and acute and chronic inflammation, like how if there is any injury, then how will it repair? And then we'll see the repair and regeneration, like what is the difference, then the concept of regeneration and repair, skin wound healing and abnormalities in tissue repair. So what is the difference between repair versus regeneration? So in regeneration, there are some tissues which are able to replace the damaged components and essentially return to normal state. This process is called regeneration. And tissues whose cells retain the capacity to proliferate. For example, in the rapidly dividing epithelium of the skin and intestine, and the liver can undergo regeneration. So in regeneration, there is some injury, and your tissue will be able to again go back to normal state, like in the same condition like it was previously. So this is called as regeneration. It happens in the rapidly dividing epithelium of the skin and intestine and in liver. Like liver is a classical example of this regeneration. As you have, I think you would have heard in the physiology and all, like the liver is able to, like it's capable, even small tissue, small part of liver, if it is kept like 1/3, 2/3 is resected out. Like it's been operated and it's taken out from the body, and even if 1/3 liver is left, it can again get back to its normal size by few months and months to year. So this is a classical example of regeneration. The function and everything will be like normal liver only. And what is the repair? Repair, the classical thing is scar formation. Like whenever any repair is there in the tissue, it will lead to scar formation will be there. Like if the injured tissue are incapable of complete restitution, like it's not able to completely, come into its normal functioning, or if the supporting structure of the tissue are severely damaged, and repair occurs by laying down of connective tissues like fibroblast and all. Those are the cells which comes in those areas and leads to this repair. So there will be scar formation. So if any fibroblast is seen in any inflammatory, in any injured area, so just it is it's sure that the tissue will be having this, like scar formation will be there in the tissue. So regeneration of liver is a classical example of repair by regeneration. I told you, it is triggered by cytokines and growth factors produced in response to loss of liver mass and inflammation. In different situations, regeneration may occur by proliferation of surviving hepatocytes. Like the surviving, whatever hepatocytes are there, it will try to regenerate, it will try to divide, mitosis, and this try to it will try to substitute, not substitute, it will try to regenerate this other part of the liver, and repopulation from progenitor cells. Like there are some stem cells which are there in the body, so those cells will try to produce, they will try to form this other lost part of the liver. And these progenitor cells have been called as oval cells because of the shape of their nuclei. Some of these progenitor cells reside in specialized niches known as canals of Henning. There are some canals of Henning which are present in your liver only, which actually gives rise to this stem cell. These are the stem cells which gives rise to part of the liver which is lost. So you can see this is the regeneration procedure. In the sinusoids there will be Kupffer cells, the TNF will be released, and it leads to interleukin 6, and then hepatocytes. It will go into transition phase of mitosis, like G0 to G1 transition, and then epidermal growth factor receptor, and then HGF. act on this, and there will be proliferation of the liver cells. And once this proliferation, the original shape of the liver is restored, there will be there will be negative feedback to the liver cells for stopping this mitosis, and so that there won't be extra formation of the organ. And what a scar formation is a response that patches rather than that restores the tissues. So there will be patches of formation, whenever you have seen any injuries there on the hands or somewhere, like you have fallen somewhere and you got scratches and all, there will be some some patches will be there, other kind of different somewhat whitish areas will be there. So those are the patches which are formed in this scar formation. The term scar is most often used in connection to wound healing in the skin, but may also be used to describe the replacement of parenchymal cells in any tissue by collagen, as in heart after myocardial infarction. So even after your myocardial infarction is a condition in which your heart cells dies because of less supply of the blood to the organ. So in that condition also scar formation will be there in the heart. So that is also called termed as scar. But generally the scar formation we actually use for the skin, mostly we are able to see the skin and all, so we use for that. But it's also seen in the heart and other organs also we can see the scar formation. What are the steps in repair? So there is angiogenesis. There is a normal tissue and there is infection or any injury in the area. So it will lead to inflammation and formation of granulation tissue. Then there will be fibroblast proliferation, and then it leads to scar formation. So angiogenesis is the formation of new blood vessels. So what is actually angiogenesis? It's like formation of new blood vessels because of some cytokines and all, which usually are given by this area of injury, this macrophages and all. They secrete some cytokines and all, which leads to blood vessels to proliferate in that area, which supply nutrients and oxygen needed to support the repair process. So this angiogenesis is necessary for the repair process to occur, and then formation of granulation tissue, like migration of fibroblast and proliferation of fibroblast and deposition of loose connective tissue together with the vessels and interspersed leukocytes form granulation tissue. So the term granulation tissue derives from its pink, soft, granular soft appearance, such as that seen beneath the scab of the skin wound. So yes, you would have seen after the injury, there is some scratches or some ulcer and all, something is formed in the skin, and then there is a scab formation, that black color, and when you try to remove that scab, there is very pink thing which is present in that area, which is termed as granulation tissue. And then after this, after formation of granulation tissue, there will be remodeling of the connective tissue. So your tissue will try to, your body will try to, normalize the tissue like it was before. That is called as remodeling. Maturation and reorganization of the tissue produce the stable fibrous scar. The scar which is formed, it should be stable. So for that, there will be remodeling. In that collagen type, this type 2 is changed. First it is type 1, then type 2, then type 2 is changed to type 4. That is called as remodeling. When the type of collagen is more stronger, collagen comes into the place. What is skin wound healing? This is a process that involves both epithelial regeneration and the formation of connective tissue scar. Based on the nature and size of wound, the healing of skin wound is said to occur by first or second intention. So what is first and second intention? So when the tissue injury involves the epithelial layer, the principal mechanism of repair is epithelial regeneration. Only the small area, very thin injury is there, and there is no infection. Even the surgical wounds, after the surgery, but they give the incision, approximated. After that, they suture it and they approximate the wound. That is called as a clean cut wound. Those are actually healed by primary intention. So in this, generally your scar and this fibrous tissue will not be much evident. It will be very less. So that is the first intention, healing by first intention. It is the simplest example of this type of wound healing. Wound repair is the healing of a clean, uninfected surgical incision approximated by surgery. The incision causes by focal disruption of epithelial basement membrane, continuity and depth of relatively few epithelial cells and connective tissue cells. And what is healing by secondary intention? When cell or tissue loss is more extensive, like there is more area of damage, like big area of damage, and such as wound, large wound, abscess, ulceration, and ischemic necrosis, like the infarction and all. So these will lead to formation, like healing by second intention. So there will be like a big scar formation will be there, like scarring will be there. So first intention steps. What are the steps? Like first 24 hours, wounding causes the rapid activation of coagulation pathway. Like if there is injury, there will be like this activation of coagulation pathways, like recruitment of platelets and all. It will try to stop the bleeding immediately within 3 to 4 minutes, which results in the formation of blood clot on the wound surface. As dehydration occurs in the external surface of the clot, the scab covering the wound is formed. So neutrophils are seen in the incision margin, and they release proteolytic enzymes that begin to clear the debris. So epithelial cell proliferation starts at the edge of the wound. So I told you in the first class in acute inflammation that how this I told you that margination, rolling, then your diapedesis that happened, then neutrophils used to come to the site of this injury and it's try to kill the microorganism and these things and try to clear the debris. So this is the one happening in the first 24 hours. And then 3 to 7 days, then in the 3 to 7 days, neutrophils will be replaced by macrophages and granulation tissue will be formed in the incision site. And then collagen fibers and fibroblasts are seen in the incision margin, and epithelial cell proliferation continues, forming a covering approaching the normal thickness of the epidermis. So, and then what happens in the weeks, like epidermis recovers to its normal thickness and the process of blanching begins. So what is actually blanching? When you press your skin, then you see there is like some whitish area appears, that is known as blanching, and when you leave it again, and then it will come to its normal condition. So this is called as blanching, accompanied by increased collagen deposition within the incisional scar and the regression of vascular channels. And by the end of first month, the scar comprises of cellular connective tissue largely devoid of inflammatory cells and covered by an essentially normal epidermis. Like by the end of first month, your normal this inflammatory cells and all and everything will be taken out from the area, and normal epidermis will come over to that place. However, the dermal appendages destroyed in the line of incision may be permanently lost. Like you would have seen, like in the after the injury, there is like this big injuries there in the body or anywhere, and then you'll see that there will be no skin. It will never come, like because of the formation of this fibrous tissue and fibrous areas. So those dermal appendages that will be lost forever, and the tensile strength of the wound increases with time due to collagen cross-linking. So the tensile strength, like the strength of the wound, it will be like coming up again with the collagen cross-linking. Like there will be cross-linking between collagen for the tensile strength to build up. But actually, you should remember that if there is a injury to the tissue, like there's any cut or something, then even after like 5 years, 6 years, your same strength of the tissue will never be able to achieve. It will be only 80% which will be achieved. Like maximum 80% of strength will be achieved with the process of this repair. It will never be 100%. Wait any time in your life. So, and then healing by second intention. The fibrin clot in this, it will be larger and there will be more exudate and necrotic debris in the wounded area. So inflammation is more intense because of large tissue defect and has a greater volume of necrotic debris, exudate and fibrin that must be removed. So larger defects require a great volume of granulation tissue and fill in the gaps and provide the underlying framework of the regrowth of tissue epithelium. A greater volume of granulation tissue generally results in greater mass of scar tissue. So wound contraction generally occurs in the large surface wound, like there will be large deposition of fibroblast and all, and in the later step there is a step of contracture, like apposition of the epithelium. So that is done by fibroblast. So they will try to contract it. So there will be contracture of the wound, and the dermal edges will be like coming close and reduce the wound surface area. Contraction is mediated by a network of myofibroblasts. So these are the modified fibroblasts exhibiting many of the ultrastructural and functional features of contractile smooth muscle cells. So these are the myofibroblasts, a modified form of fibroblast, which which is actually functionally it's more a kind of smooth muscle cells only. So in this image we can see like this is the image of the primary intention, first intention, and this is the second intention. In this you can see the area of the damage is small, and this is the large damage to the tissue. So there will be like proliferation, more of proliferation and all, and there will be scar tissue formation. And this you can see like there is less fibrin deposit, and there will be like normal tissue will be formed few weeks to months. And then in this second healing, it will be like a lot of tissue destruction will be there, a lot of fibrosis will be there. So what are the abnormalities in tissue repair? Like complication in tissue repair may arise from abnormalities in any of the basic components of the process, including discence and ulcerations. Like what is discence? Discence is the rupture of the wound occurs most frequently after abdominal surgery, and it is due to increased abdominal pressure. Like after the operation, after the laparotomy and all this abdominal laparotomy, there is like discence, like the sutures which are put over there, it is actually burst up, like it's open up. So that is called as because of increased abdominal pressure, this will rupture, like sutures will be ruptured. That is called as discence. And ulceration is that wounds can ulcerate because of inadequate vascularization during healing. Like if there is less vascularization in the area, so that will lead to ulceration. Like there will be formation of ulcer, like a discontinuity of the epithelium. For example, lower extremity wound in individual with atherosclerotic peripheral vascular disease. So these are the conditions in which there is like ulceration, ulcer formation, like PVD, peripheral vascular disease, and all this leads to formation of ulceration because of less blood supply to the periphery of the area. And then there is excessive deposition, formation of repair components like hypertrophic scar, keloid, exuberant granuloma and desmoids, and aggressive fibromatosis. So these are conditions like formation of repair, like hypertrophic scar, accumulation of excessive amount of collagen may give rise to raised scar known as hypertrophic scar. So this is a like abnormality of the tissue repair which actually happens, and mostly it can happen in any of the like scar area, but keloid, it's like similar to this thing, hypertrophic scar, but keloid it can like it's normal, it can cross its normal border of like injury. It is scar tissue that grows beyond the boundaries of the original wound. Like it can go beyond the boundary and goes and does not regress, and it won't regress, and it is called as keloid. But hypertrophic scar, it will never cross its boundary. It will be like it will be like a more position, and it will be forming over that tissue, but it will never cross the boundary. And what is exuberant granuloma? Consisting of the formation of excessive amount of granulation tissue which protrudes from the level of surrounding skin and blocks reepithelialization. Like there are some conditions like that injury in the tissue and all, like there will be formation of granuloma, and it will never heal, which actually it will be like very flesh kind of like red flesh tissue it will be formed. So it is called as proud flesh because it will be coming out of this boundary and it will be forming a like tissue. So generally it needs resection and sometimes cautery also. Like you need to like cautery the tissue granuloma for it to heal. So this is the exuberant granuloma. What are desmoids or aggressive fibromatosis? Like exuberant proliferation of fibroblasts. These neoplasms lie in the interface between benign and malignant. So these are actually interface between benign and malignant conditions, like proliferation of fibroblasts. And what are contractures? Like exaggeration of process of contraction during healing is prone to develop in palms and soles and thorax. Contractures are most commonly seen after serious burns and comprises the movement of joints. So after burns and all, we can see like there is some contraction, like fibroblasts and all, they'll come and they'll try to like regenerate, and there'll be like contraction of the tissue, and the patient like they'll have some distortion of the like skin and all, and they'll be like if there is a hand, there'll be contracture and it will not be able to move the joints and all. So those are the contracture that happens, and so you can see this is actually keloid. You can see it's like moving towards this outside this boundary, and then you can see there like there's excessive this deposition of this fibrous tissues and all. So this is actually an example of keloid. And hypertrophic scar will be also looking like this only, but the margin will be actually spared, like it won't be going beyond the margin. But in this you can see that it has moved beyond the margin also. So this is the end. and I've finished my topic. Okay.